So welcome everyone. I'm going to call the meeting to order. It is now 5:36 p.m. We'll start with our roll call. Dr. Hamid Isma.
I'm here.
Dr. Ana Diaz-Rue.
Here.
Sorry. Dr. John Rich.
Here.
Dr. Marla Gold.
Right here.
Dr. Scott McNeil.
Here.
Dr. Tyra Bryant-Stevens.
Here.
And I believe that Jen Ibrahim is joining us late today. Thank you. Okay, so I'm going to turn to Josh Roper for an explanation of the public comment process for anybody listening in.
Thank you. So for anybody attending, listening in to the meeting, before and during these meetings, the board accepts public comment. During the meeting, if you would like to submit a public comment, you can do so in either of two ways. You can either email me directly. My email address is the same one that was on the public notice. It's joshua.roper@phila.gov. That's JOSHUA.ROP as in Paul, ER @phila.gov, GOV as in Victor. Or you can use the Q&A function on the GoToWebinar app. This is a public comment process, so generally the board is not going to respond to specific questions, but before any votes are taken, the board will be able to review any comments that you submit. So thank you.
Great, thank you. So tonight's agenda, first we'll go over the meeting minutes and approve those. Then we'll talk about an amendment to the second consolidated and restated supplemental emergency regulation governing the control and prevention of COVID-19 with consolidated safety measures for full reopening and delegation of authority. Then we'll talk about the emergency regulation governing the control and prevention of COVID-19, mandating vaccines for healthcare workers and in higher education, healthcare, and related settings. So first, I wanted to check if you've had a chance to review the meeting minutes and if there are any questions.
No questions, and I'd like to move to approve.
Great, thank you. Is there a second?
Second.
All in favor?
Aye. Aye.
Aye.
Any opposed? Great, thank you. So next to the regulations, we have Joe Altman Rosenberger, who will walk us through each of these in detail. Joe, are you there?
I am. I apologize. I had accidentally just closed the document I was trying to look at. Okay. So first, I'm going to talk through the amendment to the emergency order establishing safety measures for full reopening that the health commissioner and mayor signed yesterday, and that was effective this morning at 12 a.m. This amendment changes the full reopening order that had previously been adopted by this board in its consolidated, its second consolidated order that we've been discussing. And basically this amendment would require any business that is operating indoors, it requires that individuals in any indoor setting be masked unless an exception exists, specifically unless the business operating on the setting requires everyone on site to be vaccinated and has instituted a reasonable procedure for confirming the vaccination status of staff, customers, and any other individuals present. And it clarifies what indoor means, which is consistent with other prior emergency orders and regulations passed by this board. Which is that indoor means a location enclosed by 3 or more walls or other non-permeable barriers and an overhead covering, such as a roof or a tent top. Tents with one side open are considered indoor, and in contrast, a space that is fully open on 2 or more sides is considered an outdoor space. Now, the regulation of the board adopting this order, which I'll get to momentarily, actually will make a slight change to that provision, but I'm going to go through the rest of this order, just explain what is implemented now, and then explain the changes that the board, that the health department is proposing the board make when it adopts it as a regulation. So the second situation where individuals will now need to be masked is with respect to outdoor events with more than 1,000 attendees, unless one of several exceptions are met. So unless the event is exclusively seated, or unless the business operating the event requires everyone on site to be vaccinated and has instituted a reasonable procedure similar to the prior exception for the indoor setting, or 3, the Department of Health has approved a safety plan for the event that provides otherwise. So there may be circumstances where a combination of vaccinating and testing or so on is appropriate for a particular event. It gives that flexibility. Now, the masking order that had been in place previously required masking at certain other institutions, and you can see that there at healthcare institutions, at congregate facility, and indoors. And so this provision also, this amendment also changed the exceptions that apply to any of the places where masks are now required in the city. And so if we scroll down to page 4, in other exceptions, it says face coverings are not required to be worn when eating or drinking. And the strike through is language that's being removed, and the bold italics are language that are being added. I apologize, I should have clarified that at the beginning. But this provides that when you're eating and drinking, for the exception to taking off your mask to apply, you must be seated. And again, the regulation that the Board of Health, the Department of Health is proposing you adopt makes a slight change to that I will speak about in a moment as well. And this C is just the same as a prior, the prior exception for swimming. It just broke it out as a separate section because it made more sense with that change. Okay. If there's any questions, you can let me know. Otherwise, I'll go into the amendment to the second consolidated order, second consolidated and restated supplemental emergency regulation that would adopt this with some minor changes. Okay, here are no questions. I'm going to speak to this regulation. So the board's underlying regulation, the underlying second consolidated and restated supplemental emergency regulation had adopted the Mayor and Health Commissioner's prior full reopening order that had masking in limited circumstances. So this regulation will clarify that it is now adopting the amended order with some certain substitution of specific language. So we had spoken just a moment ago about where face coverings are required and how there is an exception for indoor seating if the business has required everyone on site to be fully vaccinated. And this is actually another, we may ask for administrative change to this as well. But I think that is intended to be fully vaccinated on site. This would allow the exception only businesses that are not essential businesses would be permitted to have an exception for full vaccination on site. And I will let Dr. Bettigole explain this further. But I think there was a concern that there's some essential stores that if they were then closed to individuals that are not vaccinated or individuals that cannot be vaccinated, that could be problematic. So essential business has been defined here as a grocery store, pharmacy, doctor's office, emergency or urgent care, medical facility, or similar facilities, patronage of which is essential for daily living or needed on an emergency basis. So that is one change. Are there any questions with that suggested change?
I can just explain. I mean, you may have already followed this, but we don't currently have any stores that fall into that category or businesses that fall into that category that we're aware of. But there's a lot of fear about everything right now. And one of the things that parents of young kids are worried about is that what if grocery stores had vaccine mandates and now I can no longer take my child there? So, you know, we're preventing something that doesn't currently exist, but so we don't think it has public health implications to do that. It basically says we have masks in those places, but they wouldn't have a vaccine only rule and then, you know, bar kids from coming in. Any questions or worries about that?
And Dr. Bettigole, may I ask when in 1.1D, where it says that the requirement does not apply if the business operating at the setting is not an essential business and such business requires everyone on site to be vaccinated, I believe that should be fully vaccinated. Is that correct? They have to have had two courses
Is an essential,
or one.
wait, it does not apply if it's an essential business. The essential businesses would require people to be masked, correct?
Oh, no, I'm sorry. If it's not, I'm talking about the exception. So if the, right, it says the requirement does not apply. That's the requirement to be masked. If the business operating at the setting is not an essential
yes.
business.
Yes, right, and should be fully vaccinated, not just vaccinated.
Right. I just wanted to call that out because in addition, to the extent we're going to ask the board to make any administrative changes, I would suggest having whatever motion note that that will be changed as well, because that's more of a substantive change. Okay, now I'm moving to the second change. So in the order, section 2B2A, when we're talking about the exception for sitting to eat or drink, the order provides that face coverings are not required to be worn when eating or drinking, providing that that may only take place while seated. The language that the Board of Health, excuse me, the Department of Health is suggesting the order be amended to read is that face coverings are not required to be worn when eating or drinking, provided that eating or drinking may only take place when seated or standing at a table with 4 or fewer people.
So this is to try to accommodate restaurants that have standing tables, but to avoid the kind of mixer situation where there are standing tables, but everybody is still very, very close together. So we're trying to kind of walk a line there.
And Joe, I think this is probably one of the administrative changes, right? Where it's seated at a table of any size or standing at a table of 4 or fewer, or is it?
Yeah.
So it might need a comma there.
Okay, I would actually say that okay, yes, we should clarify that that is the intent. That makes sense.
Yeah.
And then the other changes to this regulation are more administrative in nature. The regulation, excuse me, the second consolidated regulation listed a number of regulations that were not affected by the second consolidated and restated emergency regulation. And we are just adding some that were not superseded by that regulation. That regulation superseded very specific regulations, and there were a couple that were neither in the superseded or still in effect category as listed. So we just want to list them here as a matter of administrative cleanup. That's D and E. Fines and penalties. The Board of Health early in the pandemic passed a regulation increasing potential fines and penalties in certain circumstances, and the vaccine information statement regulation, which allows certain minors to consent to receive the COVID-19 vaccine without a parent or guardian present. And then F, if the board chooses to adopt the vaccine, the emergency regulation governing the control and prevention of COVID-19 mandating vaccines for healthcare workers and in higher education, healthcare and related settings, then this would be another regulation that would still be in effect. This is just helpful for administratively gathering all the listed regulations that are still in effect in one place.
I have a question about the face coverings are not required when eating or drinking clause. So where do bars fit in here? So people at the bar, what is that? If they're standing at the bar, that's not a table.
Right.
So what's the intent?
You have to be seated. What we're trying to do with this is to allow restaurants and bars to stay open, but not have that press of people close together, masks off, eating and drinking. So if they're seated at a bar, that would be okay. But if they're, standing packed in like that, that wouldn't.
So if they're seated at a bar, it's okay. That would be under the seated piece of this. When seated,
I'm saying this wrong, I guess. They would be seated in a bar. You mean seated at the bar itself?
yeah, I'm asking, yeah,
Yeah.
I'm not sure, well, it wasn't totally clear to me on reading it, how this applies to people who are either standing or sitting at the bar.
So I believe the language says if they're seated. Does it say?
Yeah, I think that's exactly right how you described it. I think if they're seated right now, and Josh indicated that there was going to be a comma added, and I would suggest that to the extent the board chooses to do so, that it in its motion specifically specify that seated, there's no limit to the number of people if that's what it so chooses, and that standing, there is the limit of 4. But that is, I believe, what was intended. Seated at a bar, there can be as many people as there are seats. Standing, people cannot stand at the bar and drink unless there's fewer than 4 people at the bar.
So effectively, this is meant to be harm reduction. It's not perfect.
So is the idea that the bar will already have the seats socially distanced, or there's no regulation around that?
So we aren't doing capacity limits or distance requirements in this regulation. There's some distancing that will happen if people are seated. You won't have as many people packed together.
Okay.
I should say, as currently written, it doesn't have distancing.
So it sounds like the reason for this is really just to keep the bars from getting packed with lots of folks
Yes.
and with faces uncovered.
Yes,
Correct.
that is the goal.
Got it.
Are there other questions or comments about this? And I do want to take a minute to check if there's any public comments that you'd like to address. Don't think. Josh, are there?
Let me just make sure 1 second, but I don't believe so.
Thank you.
Yeah, so the only comment is the one that came in before the meeting, which you should be able to see in the chat box already.
I don't see anything in the, did you paste it in the chat box? I don't see any, do other people?
I'll put it in again.
Okay. Now I see it, thank you.
Problem.
Any other comments?
Actually, sorry, one just came in. Good.
Should we be able to see it, or are you trying to paste it in?
Yeah, it should be in the chat now.
I can see it.
Did it show up for everyone? It's just a process of question that I could address.
Yeah.
Yeah. So the regulation will be posted on the records website. Let me get the URL for everyone. It's regulations.phila-records.com, and I'll put it in the chat to everyone who's listening in.
Great. Thank you, Josh.
That should be posted tomorrow.
Any other comments or questions on this regulation? Is there a move to approve?
So moved.
And could we clarify that the movement is to allow also the commissioner to make administrative changes to specify that the exception for non-essential businesses applies only if patrons and staff are fully vaccinated, and that the exception for eating and drinking applies to seated individuals without any number restriction and to individuals standing at a table of 4 or more.
I'm going to ask for the move to approve again, just to be correct. Thank you.
Again, I will move that forward.
Second.
Thanks so much.
All in favor?
Aye.
Aye.
Okay.
All opposed? Great. Thank you very much. So we'll now move to the second regulation. Joe, can you walk us through?
Yeah, just give me one moment. Okay. So this is an emergency regulation governing the control and prevention of COVID-19, mandating vaccines for healthcare workers and in higher education, healthcare, and related settings.
Also, just for the recording, Jen Ibrahim joined the meeting.
Thanks, Josh. So the proposed regulation, as most of the Board of Health do, notes a number of whereas clauses regarding facts concerning the pandemic. And in this situation, it includes that individuals who provide healthcare and related services are frequently in close contact with patients and clients, many of whom are at the highest risk for negative outcomes from a COVID-19 infection. That there have been many documented outbreaks among staff in healthcare facilities that have frequently led to patient infection, and that individuals attending colleges, junior universities, and universities represent the demographic most likely to be infected by and spread COVID-19 at the current time. That safe and highly effective COVID-19 vaccines are now widely available, and that it is a medically accepted form of prophylactic treatment that dramatically reduces the likelihood of experiencing a symptomatic infection, and that recent study shows that available COVID-19s also reduce asymptomatic infection and transmission, and that the vaccines remain effective even against new variants of concern. So moving into this, I'm going to talk a little bit about what a covered healthcare personnel is. I'm going to walk through the definitions and then through the operative provisions, but give a little highlight first so you have a little bit of context as we're going through. So a covered healthcare personnel. So these are going to be individuals that, as we get further down in the regulation, are going to be mandated to receive a vaccine unless they have an exemption. Okay, so keep that in mind as we're discussing. An individual or individuals who fall into one or more of the following categories, excluding anyone who works completely through telework. So an employee, contract worker, student, or volunteer affiliated with a healthcare institution who performs duties in a building where patients, clients, or their visitors are present, whether or not such duties include direct contact with patients, with clients, or their visitors, but excluding individuals working in a business that is predominantly retail-oriented and provides incidental healthcare-related services such as grocery stores, convenience stores, membership-based warehouse stores, pharmacies, and similar businesses, unless the individual meets the requirements of subsection B, which means they're a healthcare worker. And rather than go through the definitions in order, I'm actually going to jump to the definitions that were referenced in this definition for a little bit more context. So a healthcare institution, so this is employees that work for a healthcare institution, is any person or entity, excluding patients or clients, that employs, coordinates, or other ways engages in the services of covered healthcare personnel in the city. A self-employed individual who provides healthcare-related services in person shall be considered a healthcare institution for the purposes of this regulation. A healthcare worker is an individual, including a self-employed individual, who provides healthcare-related services in person to patients or clients. So there's a direct contact piece there. Healthcare-related services include any inpatient or outpatient medical or behavioral health, dental, nursing, medical first responder, pharmacological, personal care home, assisted living residence, intermediary care, adult day care, long-term care facility, acupuncture, audiology, hearing aid, chiropractic care, naturopathic care, occupational therapy, physical therapy, optometry, ophthalmology, or speech language pathology services. So services of any of those natures. Okay. So that's the one group that's covered healthcare personnel. So the folks that either work in a that are affiliated with a healthcare institution and perform duties in a building where there's patients, or provide direct, excluding those places like pharmacies and grocery stores, or folks that provide direct patient services. Okay. Now we're going to talk about covered education individuals, which are the other group of folks that would be mandated to get vaccines under this proposed regulation. A person who works, volunteers, or attends one or more classes or other activities on campus in connection with a higher education institution and has in-person contact with one or more other persons identified in subsection A of this definition, which is what we just read. The term excludes anyone who does not have an in-person contact on in-person contact on campus, including any individual who engages with a higher education institution exclusively through telecommunications devices. So looking at the definitions referenced in that, a higher education institution is any university, college, or junior college. Okay, and I think that brings us through all of the definitions other than fully vaccinated, which is an individual is considered fully vaccinated when 2 or more weeks have elapsed since the individual received the final dose of the COVID-19 vaccine as recommended by the Food and Drug Administration or the World Health Organization. So now moving down to regulated individuals and establishments. So for healthcare institutions, effective October 15th, 2021, no healthcare institution shall employ, including self-employed, contract with, or otherwise utilize the services of a covered healthcare personnel unless such covered healthcare personnel, 1, has been fully vaccinated, or 2, received an exemption from the healthcare institution under paragraph 3 of this regulation, which we'll discuss shortly, and that person complies with one or more accommodations adopted by the healthcare institution. That's for healthcare institutions. For institutions of higher education, we're moving to 2B. Same date range, effective October 15th, 2021. No higher education institution shall employ, contract with, otherwise utilize the services of, or allow on campus for classes in any indoor setting, any covered higher education individual, unless such individual, again, these are going to be the same requirements, 1, has been fully vaccinated, or 2, has obtained an exception from the applicable higher education institution under paragraph 3 of this regulation and complies with one or more accommodation adopted by the applicable higher education institution. And C is healthcare workers. So these are folks that have direct patient contact. Effective October 15th, 2021, no healthcare worker may work at a healthcare institution or provide healthcare-related services to a patient or client in Philadelphia unless such healthcare worker, 1, has been fully vaccinated, or 2, has been granted an exception under paragraph 3 of this regulation from any applicable healthcare institution for whom such individual works, or if self-employed, such individual has documented the need for an exception under the relevant paragraphs in under the relevant exceptions under paragraph 3A or B prior to October 15th, 2021, and that individual documents ongoing compliance with one or more of the accommodations set forth in paragraph 4 of the regulation. Exemptions. For the purposes of this regulation only, a higher education institution or healthcare institution subject to this regulation shall grant a covered individual an exemption. Oh, I apologize. Covered individual is either a covered higher education individual or a covered healthcare personnel. So that is the one definition. I apologize, I hadn't gone over previously. An exception from the vaccination requirement of this regulation if the individual qualifies for one or both of the exemptions below and agrees in writing to abide by the accommodations required by the applicable institution, whether it's the higher education institution or the healthcare institution. And this regulation doesn't preclude the higher education institution or the healthcare institution from establishing more strict vaccination requirements for its workforce, contractors or volunteers, to the extent they are otherwise permitted under applicable law to do so. So for the medical exemption, an exemption shall be granted if the higher education institution or healthcare institution determines that the administration of any COVID-19 vaccine is contraindicated because the administration would be detrimental to the health of the covered individual. A covered individual shall request the exemption by submitting a certification from a licensed healthcare provider to the applicable higher education institution or healthcare institution that certifies that the exemption applies and stating that the specific reason that the vaccine is contraindicated for the covered individual. Such certification must be signed by both the healthcare provider and by the covered individual, subject to the requirements and penalties of Section 108 of the Philadelphia Code. The second exemption is a religious exemption. So for the purposes of this regulation only, an exemption shall be granted if the covered individual certifies in writing that such individual has a sincerely held religious belief that precludes such individual from receiving the COVID-19 vaccination. Such certification must be signed by the covered individual, subject to the requirements and penalties of Section 108 of the Philadelphia Code. So those are the exceptions. And now we're going to move on to accommodations that may be granted or granted to an individual or adopted by the institution if an exception applies. So the healthcare institutions and the healthcare institutions and the higher education institutions shall adopt one or more of the following accommodations for any covered individuals that have been granted an exception under Section 3, provided that all individuals must continue to wear face masks or other face coverings consistent with the June 15, 2021 emergency order establishing safety measures for a full reopening to prevent the spread of COVID-19 as it has been amended. And one of the administrative changes that I think we'll be asking this board to allow the health commissioner to make is to clarify that it has that order has been further amended by this board's earlier regulation that's been adopted. Okay, so for routine testing, for higher education institutions requiring exempt covered higher education individuals to submit a PCR test for COVID-19 at least weekly, or an antigen test for COVID-19 at least twice weekly, timed appropriately under the circumstances. And I'm using the acronym for PCR. It's spelled out in the regulation as a polymerase chain reaction test. For healthcare institutions and healthcare workers, testing would need to be either by PCR or antigen test at least twice a week, timed appropriately under the circumstances. A second potential exemption applies only for higher education institutions with 90% or more of covered higher education individuals fully vaccinated. which would allow exempt covered higher educational individuals to double mask indoors and remain at least 6 feet from others at all times, whether on campus or off campus, engaged in an activity affiliated with the higher education institution. And for the purpose of this regulation, double masking means wearing a cloth mask tightly fitted over a properly fitted surgical mask or a well-fitted respirator equivalent to an N95. For the last accommodation is actually a virtual accommodation. We call this virtual accommodation, but it doesn't necessarily need to be virtual, allowing a covered individual to engage with a higher education institution or healthcare institution through wholly remote means or in another manner such that the individual no longer qualifies as a covered individual. So basically accommodating them into another work arrangement so that they don't meet the requirements of this vaccine mandate. Documentation required. Each higher education institution or healthcare institution and healthcare worker that's subject to this regulation has to maintain documentation of the vaccinated status of each covered individual, and any exemption requested by a covered individual under paragraph 3 of the regulation, including all certifications submitted, whether or not such exemption was granted and why, and the accommodation or accommodations granted to each exempt covered individual. The effective date, this regulation will be effective immediately upon the filing of regulation with the Department of Records. Interpretation and implementation, and actually let me go back to effective date. It's effective immediately. However, as we discussed, the date for when everyone needs to be vaccinated or go through the testing and accommodation procedures is not until October 15th. Interpretation and implementation. Stricter regulations are permitted, so nothing in this regulation permits any business entity or individual from implementing more stringent vaccine, masking, distancing, or other mandate on its customers or those it employs, contracts with, or engages in a volunteer capacity, whether or not such individuals are covered individuals under this regulation. Conflicts, to the extent there's a direct conflict, it's going to be interpreted consistently with orders and requirements of the Commonwealth, except to the extent of the direct conflict. It's going to be interpreted consistently with applicable orders and requirements of the Commonwealth. In the event of a direct conflict, the most restrictive order requirement controls. And the city will continue reviewing inquiries and submissions regarding the applicability of the city's orders and regulations. We'll make that administrative change to businesses and activities. Inspection required. So higher education institutions, healthcare institutions, and healthcare workers must allow inspection of records that are required to be maintained under this regulation, and their ongoing operations as a condition of their continued operation. And copies of any such records must be provided to the department upon request. Any records inspected will be maintained confidentially, consistent with the requirements of Section 35 PS, Section 521.15, which is the confidentiality provision of the Disease Control and Prevention Law. Penalties. Failure to comply with this regulation will result in orders to cease operations and the imposition of fines, penalties, fines, license suspensions, and and other remedies as provided for by law, including such penalties and remedies as set forth in the April 29, 2020 emergency regulation of the Board of Health governing the control and prevention of COVID-19 pertaining to fines and penalties. And this regulation will remain in effect until rescinded, superseded, or amended by further order or regulation. And that is the end.
Oops. Thank you, Joe. Questions or comments?
I want to thank you for taking such a bold move to prevent the spread of COVID-19 in the city of Philadelphia.
Thank you. I think this will be, yeah, go ahead.
I was just going to say, I would second what Amma just said. The one thing that I would ask is in the definition, when I'm just looking over the scope, the range of different professions that are included. So when I think about a school context where kids can't be vaccinated, nursing is there, and so that would cover school nurses. But previously last year, when the governor issued emergency orders for expansion of scope of practice, athletic trainers were included. So I would advocate to add athletic trainers to that list of healthcare workers.
So I highlight right through the document questions that I have. What's best? Do you want me to just take them one at a time, or do one and then pause and see other questions?
How about if you do one at a time, but we discuss, do one, let's discuss, do the next, is that okay?
It's fine, whatever works for folks. So, okay, 2B, definition, the higher education institution, page 3, which is we call them IHEs, actually, institutions of higher ed, just so you know, here it is, employ, contract with, otherwise utilize the services of. That is incredibly broad. What are you thinking? The IHEs, I also think it's bold and wonderful. I get what we're trying to do. I'm also thinking about what's possible. So institutions of higher ed have students, they have employees, then there are associates, which can be up to 10,000 workers. There are union workers and services, allied health, police, employees. Sodexo, for example, serves most folks in the region, so that this is so broad, understandably so, but it brings up unions and all sorts of things and puts the onus on the IHE. So I'm just trying to understand what we're thinking here, because this seems incredibly broad in terms of what IHEs are able to do.
So I feel like I want to answer a question with a question, which is, if we took food service, for example, having food service workers who are unvaccinated on campus with kids seems a bit worrisome. Do you have suggestions for how you would tweak the wording or how to do this in a way that is more doable for IHEs?
I don't. I need everybody's help here. And this is just the start, because to me, the doable is that, for example, the companies with which we do business need to be mandated so that they're already vaccinated when we engage them. This kind of broad wording leaves the onus on the institution that has all of these contracts and moving pieces with literally thousands of individuals. So I'm concerned at how we implement and the scramble that could ensue.
If I may, all services that Dr. Gold mentioned are contracted services. Majority of them are contracted services, except people who come and sell us things or do demos and whatever, which is really not done during the pandemic. So when we say contract with the institutions, higher education institutions or institutes of higher education, then that covers everything. I think deleting otherwise utilize the services of, okay, is really covered in the contract with.
Can someone mention exactly where we're looking in the document? I'd like to see that.
Yeah, on page 3, section 2B.
Okay.
First sentence. So again, Dr. Smell, I'm a little lost on this because I'm not an HR expert for IHEs, but from my own role in one, I can say that this can be thousands and thousands of individuals that are set up. Some are already on campus. I don't disagree with the need, but the onus just got put on the IHE, throwing into bargaining units, and we're talking a huge number of people and organizations. And so I'm questioning that. It's one thing for students and employees. I have other questions about that. But sorry, we're contract, like they'd have to fly through all their contracted agencies and figure that out. And I just don't know the right way to go about that, or if it's wise to mandate it.
Is it possible to, I agree that the contract language in particular is complicated. I mean, even from the point of view of the simple research contracts, we have contracts with other universities for research, for example. And so that would, you know, interpreted as it's as written, that would mean that we would have to require of other universities. So there might be a way, and I don't know, but there might be a way to say, you know, folks who work on campus, there might be some language that can be so that it's at least restricted to people who are on campus. I don't know, I'm not an expert in this, but I can see what Marla's saying, that it might be excessively broad.
So I apologize, this is Joe. I just wanted to clarify that it is only folks that work on campus. So they need to have in-person contact.
Okay.
Yeah, and it excludes anyone who does not have any in-person contact on the campus.
Right, you're right.
Including anyone who engages virtually, only virtually.
Okay, all right.
I apologize, I just wanted to clarify that.
Right, so for IHEs beyond ours, this, just so we're all clear, this often will include still, not that it shouldn't, but so that we all understand, for those that don't have these mandates in place yet, it is thousands of facilities workers, food service workers, police, protective agencies, allied, so all security is allied at all institutions. Those are the main ones. And then there are thousands of per diem who come on campus. They do, I'm not disagreeing, but they might show for 1 day or 2 days or just a piece of the year. We had historically made a decision, this month, made a decision that some 10,000 individuals that may come on different days would be hard to track down, record keep, and even test, because they come and they go. So I don't know the right answer, but I want us to be clear that at large institutions, how many people we're still talking about.
I'd like to just also include that what Dr. Gold's saying is obviously applicable to healthcare institutions as well. So that we don't just talk about this just for the IHEs, because you have staffing agencies and all kinds of contracted workers coming through the healthcare systems as well. And some of them are contracts that don't necessarily rely don't result in direct services. So you could really extend this out. And to your temporary worker type situation, I'll throw out just an example of like auditors. You have an audit coming in, you've got people coming into your building. They're there for a period of time. How do we enforce that, or does this regulation allow for us to have the exemptions for certain workers that may not have patient contact?
Right, and then we're also, I'm sorry, one last piece, which is we are grappling, all of us, well, some of us are, with visitors. And the same would be true of hospitals, which we have large numbers of visitors, and whether or not we're asking them to large numbers to show proof of vaccination or mask, or we'll get to double mask and how we demonstrate that and require it. But just to throw it out there. Again, I'm not saying that it's not the right or wrong thing to do. I'm just looking at the ability for the onus to land on the hospital or the IHE.
So I have 2 contrary suggestions, and wondering if we can sort of take the temperature of the group about which if either makes sense to you, and also get Joe's thoughts about whether we can do this. But I think there's 2 basic approaches. One is to barrel on through and say, but we have to get people vaccinated, there's still risk. And the other is to insert in place of the contract and services, any person who is not employee, staff, or student who may come on campus would be required to, and then, you know, I would put double mask or wear a respirator, you know, a KN95 or an N95. It's definitely weaker, but it is also, you know, infinitely more doable. So wondering what your thoughts are on those 2 approaches.
Well, my thought is that this is a major issue that we're facing, and there is a surge right now. We can find solutions for the contracted employees. We can provide vaccination. this is a population health measure. It's not related to just higher education and healthcare institutions. It will have impacts, beyond the boundaries of a university or a college. And I think we have to take the bold move that everyone, we need to reach 80 to 90% vaccination rate to get out of this pandemic. So the language is maybe strong and broad. Let's execute it and see what we can do. The contracts are already there. So my understanding of the language, effective October 15, 2021, we cannot contract with those contractee or those who are under contract to provide services needs to be vaccinated. That's something we work with those companies. For Aramark or Sedesco, we work with them, provide them the vaccination if they have not already vaccinated their employees. Some of them have. And then they get vaccinated by October 15. And now Aramark will do the paperwork for their employees. We're not going to do it. They have to confirm that everyone who enters campus and provide food service is vaccinated, or they are under the exemption that we discussed.
Which is, again, I mean, and it's going to be a long meeting, and I don't know that we'll get it all done here. I don't disagree, but that is why, though, the IHE can't know, you won't know about your employees from an ARA or a Sedexo about who's masked and who's not, and who's vaccinated and who's not. That's the whole point. The entity, our systems where we have people uploading proof of vaccination, the same is true, I bet, at hospitals, for our employees and our students are very different than what it is. This is different than a restaurant. In other words, it's different than a restaurant or business where someone's coming in, you want them to show proof or mask up, they come in, they have a meal or they buy something and they're out. This is everyday operations all the time. So I hear you, but the systems for making this possible are not on the IHE side, a lot of it. That's all. So that's where I'm in a jam.
So this is Joe. I have a couple of different suggestions for ways that could be handled. One, in guidance from the Department of Health, and it probably would make sense to clarify, have the board, if they vote on it tonight, clarify that the Department of Public Health can promulgate guidance for implementation. But what they could do is have something where having the contractor or other folks, if there's another entity, certify to the Institute of Higher Education that that documentation has been maintained and so on, so long as they agree to let the Department of Public Health inspect or receive copies the same way the Institute of Public Health, the Institute of Higher Education or the healthcare institution would need to do under this regulation. So kind of have a derivative guidance that allows that to be done derivatively for folks that are, for situations where they can, the institute, the folks that are directly regulated can't, or they believe it would be not appropriate for them to get those certifications directly. So that's one possibility. The other possibility, and this is to some extent what we did in the proposed regulation for healthcare workers, which is to require that any entity that's contracting with an institute for higher education and putting folks on campus, that that entity has that onus and obligation to be vaccinated and so on. I think that there is still merit in having the healthcare institutions and the institutions of higher education having some responsibility for confirming that, just because the Department of Health is not going to know who the other institutions are contracting with. So I think it makes sense to have some other responsibility to provide reporting or at least some good faith engagement with those contracting entities to the extent we go that direction. Those are two different ways potentially to approach.
And I think that's very reasonable and manageable. So we deal with one entity. So Sedesco will give us a report of the people who work at the institutions serving food, that they have been vaccinated or exempted and they were double mask and so on. Sedesco will give us that information. We don't have to go employee by employee to see that they get vaccinated. Of course, they could get vaccinated with the vaccination services we provide if Sedesco up to provide them that service.
The one other thing I want to raise is that devil's advocate a little bit here, but our reason, like at least my reason for wanting this to be true at colleges and universities is about the young people. Our highest rate of infection is among young adults, and we're about to have, I believe the number Marla's told me is 100,000 of them hit Philadelphia. You know, in a choice between getting something that is imperfect done and getting it done with enough time for people to actually get vaccinated, and having something that is absolutely all-encompassing, I would choose getting it done because it's really the students we're after. It's not the faculty, and it's, you know, much though I would love to vaccinate the many contract people, you know, they're primarily not necessarily the people spreading COVID. It's going to be your 20-year-old student. So that was the reason I offered that, the sort of, you know, could we say people who come on campus who don't fall into an employed category perhaps have to double mask or whatever we want to say about that. Not because I think that's perfect, but because I do want to make sure we can get there.
Yeah, it's I mean, understood. It's tough because, you know, the food service workers, facilities, and they're actually individuals at high risk of disease if they are not vaccinated, right? I mean, this was our concern pre-vaccine. Some of the highest risk individuals, and we wanted to be able to test and get in programs. There were union issues. I don't want to belabor it. Hospitals experience the same thing. Here's the thing, like right now, the students who are positive, the ones that we know about, are 100% vaccinated. It's early, but this last 2 weeks, we're going up, and their place, I just got a report while we're sitting here, is actually a bar or an event. It is very similar to the patterns, which is 100% vaxxed, fever, headaches, chills, myalgias, and the disease, Temple's seeing it too, so is Penn. The disease, I'm saying it openly here, is coming in vaccinated students who are at food establishments or bars, some of which your recent wonderful changes are going to address, which we're really happy about. But just so we're clear, it's not coming from inside the institution yet. And we're doing what we can with massive vaccines to keep that from happening. And I think that's the most important thing if that's who you're after. So that's all. I'm just always about, like, are we creating something that can be implemented, or are we tying the hands so big that we're going to paralyze the institutions? That's what I'm asking. Scott, I mean, if you know more, I'm calling you out just because about hospitals and what you might know about those facilities.
Well, first, I just want to applaud as we started. I mean, I think this was a great idea, and it is extremely timely because most of the healthcare institutions that I'm working with right now are trying to forge this by themselves right now. I think they're going to be very, very happy to know that there's something uniform, at least across the city.
Totally agree.
I agree that getting something implemented is what we all want from a public health standpoint. But the nuances are what's going to cause all the people to complain, and you know, and we're all going to hear that. So you know, we are seeing, you know, the same things that you're seeing in terms of patients that you're seeing in institutions of health, higher learning. So I guess I want to go back to Dr. Bettigole and say, you know, I for one would like to see us try to put this through, but I want to anticipate a lot of the questions that you in particular are going to be fielding tomorrow.
Yes, absolutely.
So
with that, would it make sense to you all, and Joe, would it be possible to substitute for the contract with and otherwise utilize the services of, so instead, basically to say, I don't know how much rewording this would take to do this, but to say you're contracting with the person rather than having the be student, staff, or faculty, that they would have to, and you pick your mask option, but to get around having this stop us from.
So this is Tyra. Maybe I missed something. I've been trying to listen closely to all the nuances. But, it seems to me, given, the concerns we have, that we could still put this forward and as Scott mentioned, anticipate there's going to be some pushback, anticipate that the healthcare institutions, the higher learning institutions are all going to do the best they can, but there's no way they can control all of this. It's just, there's really no way. I think if you put masking or double masking, I'm not sure that that's going to be any better control than vaccination. I'm not sure what we're gaining with that. And maybe, again, I'm missing something, but this is just from listening to what folks have been saying.
If it's possible, requiring the vaccination of contractors is appealing to me because from the public health perspective, it's the right thing to do. And these people will be vaccinated and it will protect them in other places where they are. So I think it's the right thing to do. So is there a way that, I think Joe suggested that if the documentation burden is pushed to the contractors and off of the universities, would that help, Marla, so that, or the healthcare?
It would absolutely, it would absolutely help. It would absolutely help. I do want to say, if we're targeting if we're aiming at, if it's young people, that's the demographic. They are not getting infected from these contractors.
That's true, but that's not our only goal, right? Our goal is to improve public health in the city. And I think many of these contractors, this could be an opportunity, for them to get vaccinated because they have to get vaccinated. So I think it's a good thing. It's a good thing.
I agree.
I completely.
That language is critical then, because we're getting at those employers through IHE regulation, and that's where it gets murky. But we agree, these have always been some of the most vulnerable populations in the city all along. There are essential workers frontline within IHEs. So any way we can do that, great, but just not the onus on directly the IHE. I just want to point out that many IHEs have not mandated vaccine for students and employees. And so, and that's a big issue. And so.
I also agree, but I want to go back to that comment of saying, okay, well, we might feel comfortable kind of pushing this to the contractors because we do want that end goal of getting people vaccinated. But we're talking about something that's going to be in the confines of the city of Philadelphia. So whether it's institutions of health education or whether it's healthcare, we've got lots of campuses where some of them are in the city and some of them are outside the city. You're a contractor, you've got vaccinated, frontline staff for some of these positions to go, okay, well, I'll go to your suburban facility, but I don't want to get vaccinated, so I'm not going to go to your Philadelphia facility. That could put a problem on the contractor, and that could put a workforce problem for the people that need that contractor. I don't want to drive us back into the weeds, but I just want to counter a little bit with the idea that putting on the contractors doesn't mean that they're going to be able to get their workforce vaccinated. That's all.
And I take that and also think about the goal is to get everyone vaccinated and provide as much incentive. And then there's a health equity perspective that says these are most vulnerable people. They're also vulnerable to losing their employment. And so part of it is not to support, but to create. We're giving options to higher education institutions to accommodate. Are we going to give the same accommodation opportunity to contractors? We know that people who are not ready to be vaccinated at one point in time may be at some other point in time. I'd hate to see people lose their employment and otherwise suffer because of this. Now, that may sound like it's at the micro level, but I do think we can create incentives for folks while also creating accommodation if needed so that we keep people in work.
I think, Dr. Rich, it's number 2 in the same paragraph B. It gives them the same rights for exemption as other members of a higher education institution. So the contractor could say, I have these employees who cannot be vaccinated for the following reasons. I'm seeking exemption, and I cannot bring other employees to serve you. So these are the circumstances under the regulations. Could you please grant them exemptions? And they would be masked, double masked, and follow all the procedures and provide services.
I agree.
But it's the contractor who's doing it, not the university. We cannot really manage staff of a contractor. We manage our staff. The contractor has to come because they present us when they sign a contract. They have an insurance requirement, they have liability requirement, all sorts of other things. They provide to us. We don't go get it for them.
That's fine. I mean, for clarity though, totally agree. We are not going to, we shouldn't want to. This is PHI. We don't want to know about the religious exempted person who's being placed at our institute. Like, that's, again, that's their thing. Whatever this is, if the exemptions here as they're written apply to those we contract with, that's fine. But we're not actually getting lists of, hey, just so you know, of the 5 workers in your cafeteria today, you know, 1 is exempted and 1 is this and 1 is that. We don't want to hear that level. It also, we've been called out on discrimination on those issues. I mean, it's really tough. So it's just understanding the reality. I totally support this, but I just, when I think about operationalizing it, it's more than just an email that people are not happy. I mean, there's a lot here. I have some more stuff, but just want to make sure it's doable.
Okay.
It sounds like the sentiment of the group, at least for right now, is this stays in, but the onus is on the contract agencies to do it. So should we move to Marla's next question?
Next one's small and easy, and I think Joe will just tell us it's parsing, which is medical exemption A, the first sentence, which is determines that, you know, the IHE determines the administration of a vaccine is contraindication because it would be detrimental to the health of the covered individual. That sentence, just to let you know, the rest of it is as it is. We don't determine that. If we get a letter, like, we're stuck. How it's working right now for all of us, and I'm happy to be open to a better way, is we don't give that medical advice. So if a board certified physician, and many of us would be surprised about how many there are right now in the region writing some very interesting letters that they're willing to sign themselves to, says this person can't do it because of X. They have an anxiety, they have ADHD, it will be, they have, you know, I mean, the gamut. We are not here to debate that, I wish, because in truth, other than mast cell disease, which we've had a few of, there are not true contraindications medically to this vaccination. But there are plenty of physicians willing to write a letter of a contraindication. So I just want it clear that it's not on us to determine. So it might just be parsing of language.
I totally agree with you. That has to be a medical provider who provides care for that, and maybe qualified medical provider to write a letter, just like medical leaves and FMLAs, and confirming the status, and then we accept it.
Right. So it's just saying we have a system in place to grant medical exemption, something like that, to get us off the liability.
So this is Joe. The regulation leaves room for, institutes of higher education to rely on the certification that's submitted. I don't think that would be an issue, but it also provides room for those that want to have a more robust review of certifications to engage in that, to the extent they're lawfully allowed to do so, and they would consult with their own HR.
Penn is doing that.
We don't want to challenge the reports from a physician, because challenging it is more complex. We have to go through a process, and we have to pay for the challenge ourselves, and it costs a lot of money to challenge an opinion of a doctor to give a medical leave.
So I don't think this requires you to do that kind of review, but there is at least one institution in town that is doing a review. They're not just accepting, we're just leaving that.
And if they do, that's good for them. I mean, they can, as the regulation states, they can always take a tougher stance. So,
Right.
So that's fine.
That's right. And I think that certainly if the board allows the Department of Health to issue guidance, clarifying guidance on this,
Yes.
then that could be something that is clarified.
Okay.
But I don't think as written that it would require any particular process after the certification was received. The baseline is that the certification is received, and there's some,
Got it.
some credibility, like baseline credibility type thing.
That's totally fine. Yeah, Penn's in the same situation we are on this, and I don't mean to personalize it to our institution. We're all in that situation. If someone writes blah, 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 there's a history of cardiomyopathy, and that's not a reason, but then we say, no, that's not a reason, and they get vaccinated, and there's a poor outcome that has nothing to do with it, it's all over for us, and everyone understands that. Okay, so next, what is a sincerely held religious belief? I'm now on to B, under religious exemption. What is that, please? And does it matter?
I had the same question.
So for the purposes of this regulation, and again, institutions can promulgate something that is more restrictive to the extent they are able to do so by law. It is someone certifying that they have a deeply held religious belief. They're certifying it pursuant to the penalties under the code, but they do not have to do more for purposes of this regulation.
I mean, these things are not necessarily new. We've got many healthcare institutions that have been doing this around flu vaccination for quite a while. So many of us are used to getting these religious exemptions, and it's kind of, Dr. Gold, kind of to your earlier questions, kind of in the same situation. We really don't and can't and shouldn't challenge it.
Yeah, here I wish we could get more help from the health department, or that the Board of Health could do more, but I don't know what that is anymore. Because we have situations, for example, and I know here some institutions are acting like this, where individuals who never had an issue with all other immunizations suddenly have a religious issue with this one. And the other thing,
we're doing a study to correlate that. We're doing a study in my institution to correlate that as how many are claiming a religious exemption for COVID that did not claim it for flu or vice versa. So we're kind of looking at that right now.
It's painful. But okay,
So this is a unique.
All right, go ahead.
This is a unique situation where private institutions may actually be in a better position to have a robust enforcement of this in the city.
So religious is not defined. It's just, religious is not defined. I mean, it can just be, a person just has to say, I have a sincerely held religious belief that I should not get this vaccine, and that's enough. There has to be no additional documentation or no definition of what religious means. My religion is that I don't believe in COVID. Is that would be sufficient?
Well, if they said that, perhaps not, but they do not need to specify what their religion is for the purpose. I can tell you that as a general matter, it does not have to be a largely established religion. It can be a newer religion. And because of the breadth there, the parsing of that for the purposes of what the city can limit it to is not worth parsing. Again, your institutions, your private institutions that are not government entities may be in a different position. It's probably going to be entity by entity. There's a lot of different factors that go into this, but unfortunately, this is one where we're fairly limited.
That's why the target is 90%, not 100%. Next.
Should we go on to your next question?
I'm very sorry. And this is not, again, to our
These are
institution.
good questions.
Okay, under routine testing, we're on page 4A, small a. just for a moment for everyone, this is not a disagreement with what we are asking. However, it is clear that for many, this is considered to be an undue financial burden. I just want to touch on this for a minute, which is we are saying that exempted individuals must submit a PCR. You might say, well, it's on them. They need to go get it. But institutions need to have a way to do that. And I guess it is what it is, but for the purposes of this meeting and on the record, want to state that a PCR or antigen twice a week, there are many smaller institutions that are trying to figure out how the heck that would look. How would they even begin to do that?
So that question was the reason that we included accommodation option B, because what we heard was that there are a number of smaller institutions which at least told us that they think that they can get, they said 95% vaccinated. You know, in the worry of students partying and so on, if you had 90% vaccinated, you're going to have a lot less transmission. So the idea was if they can get most students 90% vaccinated, they could do a you know, a double mask for the ones who do have exemptions, the ones who remain unvaccinated, and not have to do the testing. And so it wouldn't be a financial difficulty for them. So that's the reason that option B is there. B would be instead of testing for institutions that get there. We do still have testing sites around the city. So, you know, we do offer testing. Part of the reason we're trying to avoid having too much testing is we think we're going to need testing in a surge. So I don't want to use all of our testing up with surveillance, but the city does have testing sites where people can go.
Okay, if that's okay with everybody, for B, large B, masking and distancing, is that what you're referring to?
Yes.
Can someone just walk through this slowly again? Because I got lost in it and didn't understand it. And I just highlight the whole thing.
Happy to do that, or happy to have you do that, Dr. Bettigole?
How about if I do my family doc version of this one, and then Joe can correct anything that's not.
I apologize that I just could not wrap my brain around it and operationalize it. So go ahead.
Okay, so this comes from hearing from small colleges that they have high vaccination rates, but don't have testing capacity on campus, and we're worried about having to pay for testing. So the idea is, if an institute of higher education can reach a 90% threshold for vaccination for their population, the remaining people who have exemptions, who are not vaccinated, would, instead of testing, would need to double mask when they're in an indoor space with others and to remain 6 feet from others. So they would have to do that spacing in classrooms. They'd have to sit a little bit apart. They would have to double mask when they're inside. They could also have the option of wearing an N95 if they prefer. We just stuck that in because people keep asking that question about the mask mandate. So if they want to, yes, they can wear a respirator mask. But so that's just so they wouldn't have to worry about the financial issue or the logistics of going to get a test if they do have that high level of vaccination.
So just if it's okay, I can quickly comment on this and just say that for at least IHEs, that double masking is impossible to, we went through this when there were variants last year, all of us, where we can recommend, where they can, sorry, because we're not going to mean this, they can recommend it, but when we require things, usually there has to be a way to check and enforce. So just so we're clear, when we do things like say, I would be attesting to, I will the exempted person double mask and I know to be 6 feet. Also, it's come up that if someone, for example, has a religious exemption and you set them apart X feet, that you are doing something inappropriate, discriminating based on their religion. This has already come up in certain IHEs around the city about masking, that if I mask, you'll pick me out of a crowd. And so, and so we've dealt with that. So I'm just making all of us aware that these are the kinds of things we may hear. No issue. Now that I'm clear on it, I was confused. I understand it's basically a safety valve for people. But they're going to be like, this is what you recommend, but there's no way to check. And the faculty may say, who are in a room, well, how do I know that it's double? There's no, how do I know what's going on here? And then it just spirals. So just letting you know.
Yeah, I mean, you're not going to be able to follow students around campus and, so they're going to sign an attestation that they are committing to do this. I think for all of this, it's going to be impossible to be 100% perfect. And we know that, but our hope is that we're going to get greater safety with this.
Gotcha. And lastly, believe it or not, under virtual accommodation, if that also can be explained, please, exactly what we're saying.
So is that students who are working or faculty who are remote?
That's right. It's actually a little bit broader than that, but that's the main gist of it. There's definitions of a covered individual, both for healthcare institutions and institutions of higher education, right? And they involve, for higher education, involve in-person contact of some kind. So if the in-person contact on campus can be eliminated, then they're no longer a covered individual. So it's accommodation so that they fall outside of the regulation, basically.
That's what I
Telework is
thought.
going to be the most direct, and particularly for healthcare institutions, healthcare workers that work in a, not healthcare workers, but covered individuals or covered personnel that work in a healthcare institution, even if they don't have direct contact, they may still be covered. There's a broader reach for those folks, but outside of that, there's some kind of personal contact required.
So I asked thank you, to avoid a misunderstanding that it then allows the learner to say that this regulation means that the IHE must offer a virtual option for somebody who doesn't, for whatever reason, want to be vaccinated or qualifies for an exemption, and therefore says, because everybody's dealing with this too, I therefore want to be online. So I hear what you're saying, but I can tell you that it will be conflated with people saying that we must have this option for an exempted individual. And that for us is a very slippery slope for IHEs in the region and nationally.
So the regulation, I understand that as a practical matter, that maybe how it comes through. The regulation specifically allows the institution to identify what accommodations are appropriate from the list. Beyond that, I will refer to any further comments from Dr. Bettigole.
Yeah, I mean, I think it says the IHE would adopt one or more of the following accommodations. So the IHE would have the choice of any one of those or more than one.
Okay. Those were my only, thank you everyone for putting up with it, questions. Two other areas which I don't think can go into a regulation, but that have become regional issues, and that is the exempted athlete and the exempted performance, the arts and athletics. Athletics particularly because demographically, even some IHEs in the region are hitting certain sports. We think that sports is extracurricular, even if it's competitive sports. But I just want to put it up there that there are some of us who think that this is a potentially dangerous situation because of exempted athletes. I think it's probably just going to be a policy issue outside of this or guidance from the health department, but it's not small.
Yeah, it sounds like something that we probably need to talk about further. As far as I understand, it wouldn't necessarily, there wouldn't be something additional in this. You could have one of the accommodations, but you might decide that for the one that came up today was wrestling. that you would want more than weekly testing.
May I go back to the virtual accommodation? I think it should be softened, if feasible, allowing a covered individual, because many times in our institution, it's not feasible to have one individual do work remotely. So if feasible and it's possible to provide that accommodation, we'll provide it. But for example, a finance person could do work from home, but a clinical teacher cannot teach clinically from home, if feasible.
Joe, do you think we could add that before allowing, just to help clarify that?
Sure. Yes.
Other questions or comments?
Ready to vote?
Well, before we vote, if people want to take a minute to look at there are a number of comments in the chat, just to review those, and then I'll give you a few minutes to do that. Just let me know if there's any that you would want to discuss or comment on.
And then we should clarify also the changes from the regulation that are being moved when we move them. So just to summarize what I believe they're going to be, allowing the health commissioner to make typographic, administrative, and technical changes, allowing the Department of Health to issue guidance regarding implementation of the regulation, and that guidance will likely come before the board subsequently for in a regulation form in some way. And 3, adding the if feasible before the virtual option. Those are the 3 I've noted.
Joe, can we also add the addition of the ATs to the healthcare professionals?
The athletic trainers.
Yeah, sorry, the
Athletic
athletic
trainers,
trainers, yes.
So any further comments or questions? Okay. Is there a move to, sorry.
I'm just looking at comments.
That's fine.
I suggest that these comments are addressed later on, not today, and some practical solutions and answers are provided in the Q&A part of the release on the website.
That's a good idea. Thank you.
Now, institutions like us, we are accommodating. We provide free testing. We can provide a lot of things, including masks. So for the people who ask these questions, we try to help as a public health, as a public institution or a public-private institution or any institution, whether it's private or public, try to accommodate and help the people who serve the students. And so it's not going to be that if you don't have a mask with you, you're going to leave the building. We're going to provide that for free. And surgical masks are available, and the cloth mask or regular mask which fit on that is a double masking.
I would also comment that in the background for athletes and for the arts, the testing algorithms are different. And so when we have situations where somebody is allowed to take a mask off who is unvaccinated because of a medical or religious exemption, in fact, they are in their amount of testing, that is what they do to make sure that we can keep people in the most reduced risk environment as possible.
Very good.
Any further comments or questions?
Are there will there be a change then in the wording of 2B that has to do with contract in terms of the vote that's going on? What was our decision? Because that is going to be the hottest spot, I think, for IHEs and hospitals.
Joe, is it possible to insert some language to indicate the substance of the discussion, basically that the contract agencies would be responsible for tracking and ensuring their folks were vaccinated, and for any exemptions. Did we lose Joe?
Sorry, I'm still here. So I think we could add language to the regulation to that regard.
Were you going to say something else?
Sorry, yes, it's not just contractors, it's other folks that are referenced as well. And to the extent the board would like to delegate to the Department of Health to issue guidance, whether in the form of an emergency order or something more informal before the board next meets, I think that there's room to clarify that in implementation. But if we're actually talking about changing the language, I don't know that it's so simple as saying contractors need to maintain the documents. I think that the board is clear that the Department of Health is empowered and directed to issue guidance and implementation regarding implementation to assure that the higher education institution and healthcare institutions are not receiving certifications for folks that aren't their employees or students. But I think it's going to be complicated how that has to end up going, and I think it's better done by order or guidance, however the Department of Health chooses to pursue that guidance. Does that make sense? Marla, is that?
I think so, yes. And then what about, we didn't talk about this, visitors to the institution who come in, parents, admissions, there are plenty of people who visit all the time. Are we saying anything about that in terms of visitors all must be vaccinated? I mean,
Well, we have screening questionnaires. The first questions in them is whether you're vaccinated and fully vaccinated. If they're not, then they have to answer a questionnaire screened. There are some institutions issue a green pass for them to enter. Their visit is limited for certain functions. They're not spending days with the institute. So I think we shouldn't change that.
okay.
I was about to say this regulation doesn't address it. It only addresses for higher education a person who works, volunteers, or attends one or more classes or other activities on campus in connection. So if they attend one or more classes or activities on campus in connection with a higher education institute, then it would. But if it's not, if it's a visitor that's not attending a particular class or activity, then it wouldn't, if that makes sense.
And I think that we can also, I mean, we're going to need FAQ on this, and we'll be developing those over the next few days. I think that's probably another question that we'll need some guidance on our site to address.
For what it's worth, semester move-ins are within 1 to 2 weeks for the vast majority of these places. I know you know.
Yeah, I mean, you know, one of the reasons, and you know, we could easily spend weeks or months making this even, like, you know, there's been a lot of thought that went into it, but we could make it better with more time. But the problem is, the longer we wait, either we push back October 15th, or we give people less time to implement. So you know,
I think we take the plunge. I agree.
So is there a move to approve?
So move.
Move to second?
Second, this is Jen.
All in favor?
Aye.
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 Any opposed? Thank you all. I'm hoping this helps us control things.
When will this become public? How was this going to happen now?
There's, I believe, a press conference tomorrow morning. At that press conference, I do plan to say that we're anticipating lots of questions we may not have thought of, and we will, you know, need to issue more and more guidance, and we may need to tweak. And so I may be coming back to you with tweak requests, or there may be some things that we can just deal with guidance. But I think, you know, the ability to give people time to plan is really important here. And, you know, I'm willing to take a certain amount of flack in public, which I'm sure I will, for what we don't yet know, in order to do that.
I also do want to clarify, this is Joe. Once it goes on the board's, excuse me, once it goes on the Department of Records website, it's going to be advertised in newspapers as well as on the website. There's going to be an opportunity for folks to request a public hearing, which would be similar to this, where people can comment again, and then the board can decide to make changes after that. So obviously we would want that to be quick and robust, given that the timing for rolling, like having folks fully vaccinated is October 15th. But it's not that there isn't any room for further consideration.
So thank you all very much. I think that the questions were actually really helpful to help us think through, you know, what we need to tweak and think more about, and really for your commitment and your time and your insight. I really want to appreciate all of you. And to the people who called in, thank you for your comments and your interest. And Joe and Josh and Jim, thank you all very much for supporting this. Everybody have a good night.
Thank you.
Thank you.
Thank you.
Thank you.
Good
Take
evening.
care.
Take good care.